Good afternoon, everyone. I will be discussing mental health and concussion and what we can do to increase wellness resiliency. And we'll be discussing a bit what you can do at home as well today. So in general, without even considering concussion, about 70% of individual lives with a mental illness and sees their symptoms begin before the age of 18. And so mental illness affects about 1.2 million of children and youth. And by the age of 25, that number really rises at 7.5 million. So about 1 in 5 Canadians will have a mental health disorder. And based on these numbers, we were really interested in understanding really what's the relationship between having a concussion and mental health outcomes. As we previously saw with Jen Kish's presentation, it seems that concussion does really affect, cognition, but mental health as well. So we were really interested on seeing that association. So what we did is we did a 10-year province-wide health administrative data study. And what we found is that children and youth who had sustained a concussion had 40% increased risk of developing a mental health issues 10 years after their first concussion. They also had 49% risk of self-harm, as we can see in that panel C on the screen. And they had 47% increased risk of psychiatric hospitalization after having that unique first concussion, as we can see here in panel B. And when we compare these children, we compare these children with an orthopedic injury group, and they were matched on age and sex. And so concussion seems to be really linked to mental health outcomes. And, perhaps we do need to start paying attention more to that outcome, something that we haven't really been good at doing in our guidelines. And in fact, up to 35% of children and adolescents report ongoing symptoms such as headache, fatigue, irritability, insomnia, difficulty concentrating, depression, anxiety that lasts for months to years post-injury. And these symptoms do lead to poor quality of life, poor performance in classroom, and reduces their social interactions. It has been suggested that these adolescents and youth might be more vulnerable to these social and psychological affects after sustaining a concussion, and which might be due to their development in central nervous system. So it might be due to the fact that their system or their nervous system is still developing. And not only that, but it has been also established that premorbid psychosocial factors and pre-injury factors such as attention deficit, mood concerns, anxiety, how people cope, so their coping strategies are best established indicators for persisting symptoms. And so the initial injury severity doesn't really matter in time. It's really these psychosocial factors that will determine who goes on having these persistent symptoms. And so given the importance of increased risk of mental health issues and psychosocial predictors being linked to poor outcomes, the rationale for psychologically informed treatments, such as, for instance, mindfulness-based intervention in the acute and chronic stage, seems to be really relevant. And this is what we will be discussing today. So studies that we are doing currently at CHEO. So what is mindfulness? Mindfulness is a secularized practice, and it's really defined as paying attention in a particular way on purpose in the present moment and non-judgmentally. So the efficacy of mindfulness therapies stem from its ability to change maladaptive behaviors and coping habits that drive psychiatric symptoms, so mental health symptoms, such as perceiving negative thoughts and feelings as objective truth rather than transitory mental health events. So central to this theory of mindfulness is that it promotes awareness of reactive habits that are used to cope with stress, allowing us to decide between an adaptive response and actual or maladaptive response. So I give you an example. So this were just really a lot of definitions. So let's say you're at work and your boss criticizes you negatively at work. Instantly, you actually might feel the urge to quit your job just to avoid further criticism. Or alternatively, you can consider reviewing that criticism as a change to improve your work. So if fear and avoidance is the overlearned response, this is how you've always coped with these type of situation, you might actually leave your job because you want to prevent yourself from suffering from more criticism. So you want to kind of, it's your natural way or urge to protect yourself. But if you become aware of your reactive behaviors and you consider how else you can manage it, you're actually going to keep your job. And so this intentional, non-judgmental exploration of the present moment experience kind of disrupts this habitual implementation of these existent perceptual and behavioral habits that we have. And so by teaching these mindfulness strategies or these non-judgmental awareness of experience strategies to children, mindfulness-based interventions encourage adaptive responses to bodily sensations, so the pain that we have after having a concussion, but it also gives us adaptive responses of how to deal with our thoughts and emotions and stressors after suffering from a concussion or a traumatic event. And that might be useful for managing emotions, thoughts, and stresses post-injury after a concussion. And so we developed a model here that we see, and we do believe that these mindfulness-based intervention might be useful for children and youth and for adults to adapt and increase their resiliency after an injury by managing their stress and by as well increasing their adaptive belief and coping behaviors. And we're hopeful that this will actually reduce our symptoms and might actually reduce the risk of developing what we call persistent post-concussive symptoms. The issue, however, is these interventions are really costly. It is really costly to actually go see or get a therapy session in mindfulness. It is not easily accessible as we require trained therapists, and they require really a lot of commitment from patients and from parents as well, as you require to be there on a weekly basis, and you have long homework to do at home, such as learning skills, and these therapies can last between 8 to 16 weeks. And so we thought that perhaps a mobile health would offer more of a powerful platform to increase access to mental health intervention. And this might be useful as well for those that are living in rural places in Canada. And so what we have done is we have developed with our partners called Mobio Interactive, a mindfulness-based intervention platform that is given over an app, so on a phone. And we are currently validating this app with, so it's now a Health Canada regulated trial. And so this intervention consists of a 4 to 8 week custom-made program for youth that had a concussion. And it's about 10 to 15 minutes per day for a minimum of 4 days a week. And it's based on formal mindfulness-based interventions, so mindfulness-based stress reduction programs. And what we do is we encourage participants to go through our app and listen to the psychoeducation that we provide, but we also provide meditation sessions such as body scans, learning how to breathe, walking meditation, and journaling events as well. And so the app kind of looks like this, and so we have different interfaces for it, but I'd like for you to listen to a sneak peek at our app.
I'd like to introduce a new technique for helping you to cope in stressful situations. It's called STOP, S-T-O-P. This creates space throughout your day to pause, slow down, and get back to the present moment. Taking a brief pause, even for a minute, can help you determine the best action moving forward by responding rather than reacting. Reacting is automatic. It's like a reflex. It's a response to something that happens quickly without thinking too much about it. Responding, on the other hand, means that you think about each option that you have and you carefully choose how to move forward. When we use STOP, S stands for stop, to interrupt your thoughts and to pause what you're doing. T is for take a breath, just noticing your breath for a second. Take a few breaths in and out of your nose, out through your mouth. O is for observe. Become the observer of your thoughts, feelings, and physical reactions. You can make a note of whatever you're experiencing and sit with whatever is there just for a moment or two. And P is for proceed. Carry on with your life. So after you've stopped, taken a few deep breaths and observed what you're feeling, you can mindfully consider your options and the best way to respond. Try using this at least once a day, or whenever you find yourself in a stressful situation.
So just to wrap up, in summary, mental health is present in the pediatric population, in the general pediatric population, but in concussion as well. And maladaptive behaviors and increased stress may actually cause increased risk of persistent post-concussive symptoms and may actually increase our symptoms as well. And so for parents, what you can do is just knowing that there is an increased risk for your children and youth to develop a mental health issue post-concussion, you should be on the lookout for these worrying signs or indicators and be really open to speaking to your child about what they're feeling and what they're experiencing. So here, the key is to communicate with your child, and together, if you feel that there's an issue, you can seek help towards your physician or a mental health specialist. And for specific screening tools or management for mental health issues, you can refer to the pediatric concussion guidelines that we have that you can find on pedsconcussion.com. And just one more thing that we need to remember is just returning to school, returning to physical activity 48 hours after the injury is very important, as we have demonstrated several times that this helps decrease symptoms a lot at 4 weeks post-injury. Thank you.